Yeah, hi guys, I'm Dr. Rajat, and today I'm going to be talking about deep teeth cleaning. Now what's that? Scaling and root planning, which is commonly referred to as deep cleaning or gum therapy, is the removal of plaque along with smoothing the roots of your teeth. And when patients who visit our office are diagnosed with gum disease, a deep cleaning is what we recommend. Now, how do I know that if I have gum disease? Now, some typical signs of gum disease that we most commonly see in our office are swollen and bleeding gums, especially while brushing, calculus near or below your gums, bad breath, and pain in your gums. However, having one or many of these symptoms doesn't mean that you can't dramatically improve your oral health. Depending upon the stage, the severity of your condition, deep cleaning you will receive at our institute in combination with improved habits and oral hygiene that we'll cover can help you get back on the right path for your gums and teeth. Now, what will a deep cleaning do to improve my mouth? Now, by removing the bacteria from underneath your gums, once this is done, your gums will have a higher likelihood of shrinking back to a healthier, more stable state. This will also help to reduce or eliminate bleeding while you experience while brushing, while at the same time improving your overall gum tissue health, which will ultimately help to keep all your current teeth present and in correct place. Now, does having the deep cleaning means that my oral health is reset back to great? Unfortunately, the scaling and root planning procedure doesn't automatically restore your gums back to their original and pristine condition. This treatment is made to preserve and improve the gum disease that remains. And while we can't go back to the old days, keeping your tissue that you have and building onto new healthy habits, that can make a drastic improvement. Additionally, we will prevent the progression of your gum disease, which is also nice. Now, following deep cleaning, it is also very important to implement great habits to keep your remaining gum tissue healthy. So we recommend brushing twice a day in the morning and before bed, flossing at least once per day, an antibacterial mouth rinse at least once per day, and scheduling and showing up for your regular visits does help. Now, building these great habits goes a long way. We love seeing our patients in our office who have had a deep cleaning a few years ago, and because of regular brushing, flossing, rinsing, and maintenance visits, they have reached a consistent and long-lasting quality of their health in their mouth. No more bleeding or puffy gums, bad breath, or invading bacteria. These patients who have really bought into keeping their mouth healthy reap all the benefits, and they are so inspiring to see on a regular basis. Now, what is going to happen during my first deep cleaning that most of our patients have asked us? Now, following our assessment, we'll use few injections of anesthetic to numb your teeth and gums. That also depends upon the severity of the condition. So then we'll use a water pressure tool to clean out the bacteria before doing our final assessment, and also maybe taking some additional x-rays to make sure that we have removed all the bacteria. Because of this process can be overwhelming to some patients, we like to schedule half of the mouth, right or left side, for their first visit, and then other side during the second. Now, what can I expect to experience after my deep cleaning? You should still expect to see some bleeding and general soreness following the condition because of the work that has done throughout your mouth and below the gums. That is common. So this will subside a day or so after the procedure. A unique feeling once the SRP is complete. Now, what do you mean by that? So it's basically because the bacteria have built up over many years below your gums. Now, once the bacteria is gone, it is very common to feel that you have holes between your teeth and even cavities in them. So don't worry in that case. So what's true is that so much of bacteria has been removed so that your gums can shrink back to healthy size. Although the feeling is a little weird one, but it is a great sign that you've just made a tremendous progress. So that is pretty good. So as always, if you have any questions regarding deep cleaning, you can schedule an appointment. You can send us an email or give us a call. We will talk soon. Thanks a lot.